Hello, moms. Hope that you are doing well. So, you all are welcome to my YouTube channel, Level Up Your Baby. In this video, I'm discussing about an important topic for our parents. Can you guess that? There is a number. Most unexperienced new parents cautiously watch after the birth of their newborns, and that is their infant's weight. Yes, it's really important point for our parents, especially for our moms. Too much weight gain or weight loss can undoubtedly transform into a world of worry and stresses to our parents. Especially for new moms, it will be a reason to get depressed too while they are adjusting into the new situation with their new babies. So, average weight is a common concern for parents. However, what does average weight truly mean? And what adds to normal weight loss and weight gain in newborns? Here, I'm going to answer those questions. And also, let's clarify some issues about baby's weight, that is, healthy feedings and regular poops. How can it be an indication of healthy weight? Most newborns lose a small percentage of body weight in their first few days after birth, as they shed additional body fluids they were brought into the world with. Then, after they started to pick up their normal weight, it's about 4 to 7 ounces every week. And also remember that newborns' weight relies upon many factors, including gender, hereditary qualities, parental factors, and especially mother's way of life during pregnancy. And also here I should tell you that most ideal approach to screen your infant's weight is by going to all planned pediatrician well visits. Although babies of the same age group can vary in their size and weight, so I kindly tell to our parents, please don't compare your baby's weight with other babies. By doing that, sometimes you are getting an unnecessary stress into your mind. So please don't compare your baby with other babies. And also, weight is a good indication of their nutrition and physical developmental level. So it can therefore be helpful to know the average baby weight by age in months. Remember that the normal weight isn't equivalent to average weight. On the off chance that your child's weight is in lower percentile, it doesn't really mean that anything isn't right with their growth and development and their physical development. As indicated by the WHO, the normal birth weight for baby boys born full term is 7 pounds 6 ounces, and the normal birth weight for baby girls is 7 pounds and 2 ounces. Most infants born at 37 to 40 weeks weigh between 5 pounds 8 ounces and 8 pounds 13 ounces. As per Marsh of Demis, an infant who weighs under 5 pounds 8 ounces at birth has a low birth weight. As I mentioned above, some factors are there that contribute to your newborn baby's weight. Let's talk a few about that. First one is infant's gender. Especially baby boys will in generally weigh more than girls at birth. But researchers, they are really unable to consider. Another thing is mother's weight. If mother is considered as overweight for her height, previously and during pregnancy especially, it's not uncommon to have a heavier newborn. On the off chance that mother is underweight for her height, at that point it's possible that her baby will be smaller than average. Another thing is hereditary qualities. Both parents' past and current weight and well-being can add to their infant's weight and well-being. And other thing is lifestyle throughout the pregnancy, especially drinking and smoking can badly affect it to the baby. So drinking and smoking can be a cause to reduce the birth weight of their babies, and also especially mental development also can affect with that factors. Other thing is mother's age. Younger mothers, especially those in their teens, will generally have smaller child. Birth order also can have effect with the baby's weight, especially firstborn infants. Eldest child in the family will in some cases may not exactly succeeding kids. Let's talk about newborns' weight loss. As I said earlier, a couple of days after birth, babies normally lose around 5 to 10% of their body weight. This is basically they lost additional body fluids after delivery, which shouldn't be a reason for concern. So our moms, remember that you should not worry about the weight loss of your newborn in first week. Within 7 days of birth, fresh out of the box, new children will begin pressing on their ounces, yet it wouldn't occur immediately. Remember that infants don't need a lot of foods at this time. And also mother's breast milk is as yet growing, so don't worry if it takes that time to see this shed pounds to return. What about newborns' weight gain? After the underlying weight reduction, infants begin to pick up between 4 to 7 ounces per week for around 4 to 6 months. Remember that formula contains a greater number of calories than breast milk, so formula-fed newborns may put on weight somewhat more rapidly than breast milk-fed babies. You likewise need to consider growth spurts. Infants will in generally have growth spurts after week 1, 3 and 6. So don't be surprised if your beloved newborn desires more feedings around this time. Here are some instructions to our moms to monitor newborn's weight. If you are a parent who's generally putting on infants on your bathroom scale, you're not the first and you surely won't be the last. Sadly, this won't give precise reading of an infant's weight in light of the fact that these scales are not adequately dedicated to distinguish ounce. Utilizing the scale at your pediatrician's office during booked well checks is the most exact approach to gauge your infant's weight. You can likewise think about your baby's elimination as a method of observing weight. After the first week, infants should have at least 5 to 7 wet diapers daily and 3 to 4 poops a day. Here, breastfed babies may poop more than formula-fed babies. In the event that your infant appears to be fulfilled during and after feedings,